there's many reasons why someone needs a thyroid biopsy. The number one reason is to understand the nature of the bump, to see if it's malignant or benign. So that's the most common reason that we would do a biopsy. So the ultrasound is telling us whether it looks at certain characteristics in the bump. Is it regular or irregular? Is it dark? Is it light? We call that hypoechoic or hyperechoic. Are there microcalcifications in the nodule? So it's looking for all those variables that can give us a clue as to the nature of it without a biopsy. And based on those variables, the radiologist or the endocrinologist or the surgeon doing the ultrasound will have a better idea and give it a TIRAD score. It's a scoring system from 1 to 5 that lets us know how many worrisome characteristics are there. And based on those worrisome characteristics, we know whether or not to do a biopsy or whether or not to just leave it alone. Because many people have thyroid nodules that we don't have to worry about. That's a great question. So usually what I like to do, the patient gets my email address, and so if they have any questions, they can email or they can call or any concerns. Otherwise, they usually come back or they call or they get a call from me within a week with the results. And we let them know, or I let them know what it is and what the next step is. We love it when the biopsy says benign. Benign biopsies are our favorite. That's Bethesda category 2. Great question. The most common side effect is a little bit of pain. Doesn't need Advil or Tylenol most of the time. Every now and then a patient likes that. The second most common, I guess, would be potentially bleeding or a little swelling underneath the Band-Aid, but that's very, very, very rare. But that's about it. It's similar to a blood test. And so I don't really see those complications very much. Patients generally tolerate it very well. So if a cancer is found, then we generally do a surgery to remove it. That's not always the case, but in general, we would inform the patient next week. It usually takes a week for the results. I see them, we go through everything, and we explain what it is and what surgery needs to be done. If it comes back as benign, we're very happy. We let the patient know within a week usually. And depending on the bump, we will do another ultrasound anywhere from 6 months later to 2 years later, depending on a lot of different factors.